Okay. Here you go.
Thank you.
6 pen. Okay.
Oh, awesome.
Are you ready, Mr. Clerk? Kathy, you ready? All right, let's do this. All right. Good morning, everyone. I am excited this morning to call to order our Behavioral Health Committee. Mr. Clerk, if you wouldn't mind.
Chair Brabec.
I am here.
Representatives Arbit,
Here.
Pohusky, Edwards,
Here.
McDonald,
Present.
Rheingans,
Here.
Herzberg, Schmaltz,
Here.
Hoadley, St. Germain, Thompson. Madam Chair, you have 7 members present, a quorum.
Thank you so much, Mr. Clerk. Representative Hoadley moves to adopt the minutes from the May 23rd meeting without objection. The minutes are adopted. So today we have a day that I am very excited about. We have 2 bill packages and 1 bill that we will be voting on. The 2 bill packages that we have before us are ones that we all have heard testimony about before. We know about the issues. They are around social work licensure and CCBHCs. Again, familiar topics for all of us. We have several folks who are wanting to testify, which is fantastic. We love having the dialogue. And so we're going to get started. I'm going to ask each person for both bill packages who are testifying, we're going to have a time limit of 3 minutes. And so we'll have that up here. So when you see me signal, you have about 15 seconds left. That is because we have so many people. We want to make sure that we get to everyone. So colleagues, any questions about that before we get started? Okay. All right, so first we're going to be taking up testimony on House Bill 5184 and 5185, and you all will be seeing this works in progress. What's going to be happening is that the bills are going to be updating licensing requirements for bachelor's, master's, and clinical social workers to create a jurisprudence exam and allows an additional 2-year window for those folks, those folks who have their master's degree who are past the 6-year window to, again, have access to take this jurisprudence exam so that they can come into the field, again, knowing that we have this workforce issue. So we are going to be, that's what our testimony is going to be about. And right now, the House Committee will go at ease.
The House Policy Subcommittee on Behavioral Health will come to order, and we will now hear testimony on House Bills 5184 by Representative Brabec and 5185 by Representative Edwards. And Dwayne Brabec, Executive Director of the National Association of Social Workers, Michigan Chapter.
Thank you, Chair. I appreciate it. Thank you all for letting us bring these bills back to you. We're very excited about them. A lot of work has gone into them. We're continuing to work with the department and with our stakeholders who you will hear from today. Part of what we know is that the licensure exam that social workers need to take to be able to get their LCSW is biased, and that creates issues with our workforce and with folks who have that degree who are wishing to be able to practice clinically. We know, we've talked about this in our committee, that we have such a shortage of social workers, and we have the opportunity now for folks who know what the practice is, know how to work in our communities, know what it takes to be good, ethical clinicians, and it is this one piece that is problematic. And so the substitutes that we will be offering before we vote in the upcoming weeks to be able to attain the LCSW, do a couple of things. It means that you will have to take a jurisprudence exam. Jurisprudence exam means that it is a test on the laws of social work here in our state. We have other professions in our state that have jurisprudence exams as well. So we are lining social work up with that. We are also requiring 3,000 hours of clinical supervision. That is down from the 4,000, which is the most in any state. So we are aligning Michigan with other states in terms of supervision requirements. For a bachelor's level and a your macro license, master's license, it would require, again, that jurisprudence examination in addition to schooling. We think that these changes will have profound impact on our workforce. We have seen some of this happen in Illinois when they made changes and had an influx of thousands of social workers, actually, because of some of those changes. We are hoping to be able to, as I've said, really impact the crisis that we have before us and the need to get more providers in the pipeline, and we believe this is a way to do this. This is a way to ensure that social workers not only, of course, they will have the training that they need, they will have the supervision that they need, and also then they will have a test that measures what they need to know legally here in the state of Michigan. I've been proud to work on this package alongside our colleague, Representative Edwards. We both have master's degrees in social work, and so are acutely aware of the need in the field, and are excited to have this come before you.
She just covered everything. I just want to add that this will help bring more social workers back into the field. Those who were not able to pass the examination timely, this will help them come back as well. So I really hope that everyone that's sitting back there that's absent and not here will be able to support this legislation.
Good morning, committee members. It's great to be in front of you again. This critical legislation strengthens our state, and we are really at a kind of critical pivot moment, I think, for social work as a profession, both here in Michigan and nationally. As Rep. Brabec said, we expect that these changes will bring hundreds, if not thousands, of Michiganders back into licensing who've had to leave our profession completely over the last 2 decades since the current rules have been in place. And this is the first time since 2005, which is when Michigan passed our social work licensing law, that there's been any substantive changes to our process. And maybe most importantly, it brings Michigan's licensing tiers in line with most other states at this point. We are the only state in the U.S. that uses a limited license process, and it has created several issues related to billing, reciprocity, as well as title protection as we become more and more of an international and interconnected web across the country. Since I was last before you just over 6 months ago, there's been a pretty monumental shift in creating more equitable licensing pathways across the United States. In just the last few months, 4 states, including Colorado, Utah, Rhode Island, and Maine, have eliminated social work exam requirements at the introductory level. Our neighbor state, Illinois, has eliminated the exam completely at the non-clinical level and created a pathway for that does not require an exam at the clinical level. And less than 2 weeks ago, Minnesota created an additional pathway in their state that does not require any examinations for any of their levels of licensing. Additionally, we have 5 large states, including New York, Massachusetts, North Carolina, Washington, and Oregon, who are exploring or have bills pending on alternative pathways that eliminate the current examination structure, and more than another dozen jurisdictions are working on similar plans or have work groups formed that hope to have introductory legislation or regulation in the next year or so. All of this legislative and regulatory advocacy is really occurring in large part because of 3 things: the large national workforce shortage that we're seeing for behavioral health providers, the national mental health crisis that we find ourselves in as a country, partially due to the COVID pandemic, and the extremely worrying pass rate scores that Rep. Brabec and Rep. Edwards have mentioned. Nearly every day at my office at NASW, I get calls from current social workers or former social workers who've lost their jobs, their income, and their careers due to the inability to remain licensed in Michigan. These are not individuals who are unethical, that are not incompetent, but have to leave social work because of barriers that exist within our current licensing process. These individuals often have tens, if not hundreds of thousands of dollars of student debt, have been unable to climb the career ladders within their organizations, and have had to completely change professions, which is really challenging to do when you've spent years of your life dedicated to one particular profession. And we know that many of these folks ultimately leave the state of Michigan because they will have alternative pathways in other states. Just last week, I spoke with a social worker in Farmington Hills who's been in the profession since the late 90s. She's a school social worker who is going to be let go of her job later this week because she can't pass the licensing examination. She's completed all 4,000 hours of supervision at both the master's and bachelor's level because she had to fall back on a lower degree because she was not able to get through the master's process. She's been working in her same school district for almost 30 years and is 2 years away from retirement. What do we tell these people? There's no alternative way for them to stay in the field currently. We have to make more equitable pathways and provide ways for people to stay in our licensing path. That's just wrong what we have right now. I wish it was a one-off story, but honestly, I tell you, I get calls every day that are similar to this, and it particularly impacts our social workers of color and our older social workers. We know that this legislation alone is not going to fix all the problems leading to our current workforce shortages, but it's a vital step to retain our current workforce and provide a long overdue path for individuals to come into the profession. Know that NASW as an organization is working on several other really critical initiatives to support the behavioral health workforce, including working in collaboration with our state's Working Conditions and Workforce Committee, the Board of Social Work, and the 34 schools of social work in Michigan on developing stronger supervision standards that can be implemented through regulation in the next year, increasing recruitment into schools of social work, specifically through in schools, child welfare, and larger behavioral health. Many of you have been part of those efforts to increase paid internships, opportunities, and apprenticeships in our schools over the last couple of years. We have been providing more free or reduced education around licensing process, getting past the current exam, and helping social workers get through their 45 hours of required content. And partnering with LEO and our Community Mental Health Association to develop and launch just a couple of weeks ago a new state website that aims to increase awareness about the social work profession and job opportunities in every county of our state. And lastly, one thing that I hope we can continue to partner on over the next year together is to join the more than 18 states that have already passed the Social Work Licensing Compact. We know that that will streamline licensing portability and increase access to providers. Together, I hope we can make Michigan a healthier state and continue to reinforce the importance of mental health, community wellness, and empowering each other to improve the lives of all Michiganders. I really want to thank you all for helping Michigan be a national leader in these efforts, and I encourage your vote on House Bills 5184 and 5185 when they come to vote. Thank you.
Mr. Chair, if I could make one more comment before we take questions. I just wanted to restate, I know I said at the beginning of my comments, but we're continuing to work with Laura on these bills and our stakeholders so that synergy will continue to happen before they are fully before you. Thank you, Mr. Chair.
Thank you for your testimony. We'll now take questions from the committee, and if you don't mind, I'm going to start. The first question I have is for Dwayne. I find the story you told about the social worker in Farmington Hills, school social worker, to be pretty jarring. And I just, not being pretty familiar with the nuances of the career in the field, what would cause someone who's been practicing in this field for 40 years to not be able to pass an exam? What is deficient in the exam that would lead to that? And I mean, from what I understand, that there is a high rate of failure about this exam in particular. And I'm just wondering, what is the cause of that?
Yeah, if you want to take the first, and then I can add some supplemental.
Got it. Not a problem. There's layers. The exam is racially biased. Anxiety. After you take it once and you don't pass it, it increases your anxiety, so you're not able to really focus and concentrate on that exam. At least that's what the individuals who I know who couldn't pass it, including myself, have said. The problem is the exam is not one street, one way. It's a bunch of different avenues. You take it multiple times. It's not the same exam, so you can't just study that same thing. Each time is different, which it does increase your anxiety. Some people have ended up in the hospital because they couldn't pass it because of depression. I know you didn't ask for that aspect, but some of those, that's the reasons why we're not able to really pass the examination.
The other things that I would add, particularly on for our older social workers or folks who are coming into social work as a second or third career, we know that standardized testing is already more difficult for folks who it may be 20, 30, 40 years since you've taken a standardized test. For this particular social worker, they had been out of school since the early 90s, right? And so they had attempted to take the exam 6 times at $260 a time, plus whatever study materials and time off from work that is also required. The other challenge that honestly a lot of school social workers particularly have is you're not working a calendar year. And so to gather your 4,000 hours of required in Michigan, at minimum takes 2 years of full-time work. So our school social workers in particularly are not able to take an examination till at least the 3rd, maybe 4th year into their licensing process, and you only get 6 renewals of a limited license, which gives you roughly 7 total years to complete either your supervision, your required hours, and your examination. So people's window has already shrunk quite considerably versus other aspects of social workers, which would be fixed also by restructuring our tiers and eliminating that 6-year cap. Because the other problem that this particular social worker and many others have is there's no other way to stay licensed in any capacity once you've reached that 6-year renewal cap. That is a finite number in Michigan currently, and at that point people need to either leave the state and try to get licensed in another state or find a different profession. There's another similar case where there was 6 social workers that got hired at Sparrow at the same time here in Lansing, and half of them passed their social work exam and half of them didn't after their 6 years, and so those 3 had to be let go from their jobs. And it's really challenging in many settings because social work also has title protection, and so you can't call yourself or work as a social worker unless you also have a license. So those people are also losing their professional identity at the time that they're losing their jobs.
Thank you. I do have one more question. I was wondering if you could explain, and this is for anyone, a little bit about how the restructuring would work for people who are in tiers that are going to be eliminated, and also if there is any idea of how this would affect the market in terms of like reimbursement, what people can charge for. I mean, if we're getting rid of LMSWs, are they going to be able to bill at higher rates? Like how would this affect the market and in terms of what people would be able to make as providers?
Yeah, I can take that one. So about 90 to 95% of our social work in Michigan is clinical social workers already. So it's not really going to be a huge shift for the bulk of our social workers. Just the limited license is really the big shift for many people. I'm a macro licensed social worker. I'd never had interest in doing what Rep. Brabec does or what Rep. Edwards did. And so my licensing tier is not, as of exists right now, is not often actually required as part of my job. I'm not billing for hours. And so the macro license will be folded into the general LMSW. So that is the catch-all license for anybody who's gathering hours while they're getting their supervision towards the clinical pathway, or for anybody who is not maybe required but wants to use the title social work, wants to use their skills and their degree in settings. And we find a lot of folks who work in nonprofit work, in legislative work, in various capacities that'll want that. So we don't see really any change to how billing will ultimately be impacted, except probably in the benefit, because right now our limited license, and by having an LMSW clinical, that's the technical way to write out licensing in Michigan, is not consistent with any other state. Every other state that has a clinical, almost every other state that has a clinical license, your credentials are LCSW. And so billers sometimes see an LMSW, and for other states, that's the baseline generic license, not the clinical license, where in Michigan, it's kind of both. And so this will also kind of clear up, hopefully for insurances in the future.
Awesome. Thank you. Representative Schmaltz?
Thank you for your testimony, and I appreciate everything social workers do. They deal with our most vulnerable citizens, and so I have the same concerns that I had last time when we heard testimony. Quantity over quality, again, you deal with our most vulnerable citizens. So my question is, you're taking away supervision, you're taking away testing, supervision hours, you're taking away testing. How is that going to help? And you said, well, you have anxiety and depression over taking this test. How is that biased toward one section of the population or the other?
Go ahead.
So when we're moving from 4,000 hours to 3,000 hours, although yes, it is a reduction, we are also more in line with what we see in other states throughout the country. So we are, I think we have the most required hours of supervision. So we are just simply matching what our other neighboring states and the kind of norm throughout the country in terms of supervision hours. I know that I said this last time we got to be in front of you, and I will say it again, that taking the test that is before, that folks have to take now, because they can pass that, does not make them a good clinician. That is not, like, this is not a one-for-one. I know plenty of good clinicians who struggle with the exam, and so the exam that we're suggesting is an exam of the existing laws around social work that will then guide folks in terms of that practice of social work. That is the exam that we're seeking to change to. The clinical parts that folks learn, they learn that through their schools, which need to be accredited. So the education that folks get and the supervision that they receive, both individual and when you finish your supervision officially, I can still say, even after practicing for 30 years, I still do supervision with other psychologists around cases, right? And so that never, and I don't believe for clinicians that ever really ends. It officially, I don't count those hours, but we're constantly learning and wanting to be frankly, as good as we can be for our clients.
Again, I don't see where the bias comes in, but I'm wondering, why can't you, when you take the test, if there's a certain portion that you don't pass, that you just take that portion
Sure.
again?
Do you want to take that? Yep.
Yeah, that's a great suggestion, and
Yes,
it's one
it is.
that our national organizations have provided to the board or the association that writes the social work exam. So when the disparity data came out, there was what we thought a fairly common sense group of suggestions that were provided, which include, could we look at just taking modules? So if people are struggling with one particular section, could they go back to that? Could we look at reducing repeat test fees? So if people are taking the exam 10, 12, sometimes 20 times at $260, that's $10,000, $15,000 that's coming out of a social worker's pocket, which is a lot of money for anybody.
Well, I also heard that they were offering some scholarships for this, and that's something that possibly we could look into so you didn't have to pay each time.
Yeah, that has started. There's been a little bit of work towards that. The other suggestions now in 2021, it was required that all the states, you had to have all of your supervision hours complete before you sit for the exam. We would like to see that removed so people could take their examination as soon as they get their initial licensing level. We do not, and from my experience with the exam, believe that the exam gets easier the longer you're in the profession and further away from your basic education. It actually gets much more difficult. And so we think that that's also a reasonable solution, providing free test materials for folks to study. And so those reasonable suggestions haven't happened yet, and it's been almost 2 years at this point, and so it's been very frustrating for the larger social work community as we see it in action.
I'm sorry, we've got to move on. Thank you. Representative Rheingans?
May I answer her question too, just really quickly?
Yep.
This is copying what other states have done. It's not removing the hours. It's only subtracting 1,000 hours just to take the examination, not in order to do your job. We still do supervision after we have our license, so it's not saying that once you get your 3,000 hours, you're done. It's not saying that. And I also encourage everyone with a smartphone to Google how this exam is racially biased, because you will see it across every state, how more African Americans are not able to pass the examination. People have said to black people, you should think like a white woman if you want to pass this exam. That's some bull crap. So I encourage everyone to take out their smartphones and Google it, because you will find a lot of information on why this examination is racially biased.
Thank you. Representative Rheingans?
Thank you, Chair. It's so great to see some fellow social work folks here. One of the things about my choice to go through a graduate program in social work and now supervise social work interns and help train them while they're in grad school and teach at the School of Social Work at the University of Michigan for 8 years is that our field is really based in practice. And the work we do is practical work. And what we really need to be trained in is the practice of social work. The word work is in there, right? We got to work. It's not like social PhD dissertation or social academic book reading. It's social work, right? So we got to practice. So Could any of you explain the process? Like, I know it's 25% of our graduate degree has to be in the field, even to get a degree. Could you explain the process of competencies and how we assure that each social worker is competent in the minimum competencies, and then how we continue to work on being competent as practices change? We have to stay competent and practice the practice of social work.
Yeah, so to get to be a clinical social worker in Michigan right now, it is a pretty significant process. So you have to start with your bachelor's degree, right? That has to be from an accredited university where you're going to be doing a year-long internship in the profession in your particular lane under supervision by a licensed social worker. Each school of social work has to follow 9 core competencies that are required by the Council of Social Work Education, and that includes ethical practice to evaluation, kind of everything in between. Once you finish the bachelor's degree, whether or not you get a license, you then go on to get a master's degree, which it will either be 12 to 24 months on average, with an additional 900 hours of supervised internship work. So folks are getting thousands of hours of supervised practice even before they get out of school. Once they graduate, they have to apply for the licensing process, so they have to pay, get fingerprinted, pass a background check. Then they have to get, as of right now, 4,000 hours of additional supervised work under supervision of a licensed clinical social worker and pass a national examination. It's pretty robust standards, and our pass rates are quite significantly different from other health professions. If you look at the medical boards, if you look at nursing, if you look at counseling, our pass rates are not comparable to what we see in other health professions too, which is another reason we really have to take a look at this. Examination is not a part of social work curriculum generally. That's not how we learn, that's not how we practice, because we are community-based. A lot of our work is one-on-one, collaborative group environments, writing, presentation style, and so I know that there has been conversations about what might an alternative pathway look that could be more reflective of what people do in their social work programs versus a standardized examination. And even many of our schools across the state no longer require standardized tests for part of the admission process. So we know that they have recognized that that is a barrier for qualified people to join our universities, and we think that that is also something that we have to seriously consider in our licensing process.
Thank you. Representative Bohutsky.
Thank you, Mr. Chair. I wanted to go a little bit more in depth and make sure that my understanding of like the racial bias with this examination is accurate. So bear with me, because I spoke with, my district has part of Detroit and then also suburban communities outside of Detroit. So it's kind of like a microcosm of what we're talking about here, I think. So I've spoken with social workers in the suburbs, obviously, and then also social workers within the city in my district. And my understanding, please correct me if I'm wrong, is that the examination has no truly wrong answers, but there's one most right answer. And the conversations that I've had with my social workers in Detroit is the most right answer for them is not the one that my friend in Canton would agree with, but yet that is considered wrong, even though that would not be in the best interest of the people that those social workers are serving. Is that correct? And is there, like, can you elaborate on that if need be? I just want to make sure, because like I said, I've had these conversations. It's very important in my district because unfortunately, where the need is greatest, the supply is also the shortest because of the way that this exam apparently skews. So can you elaborate on that piece?
You two want to talk about that? You've taken it.
Well, I think going a little bit back to what Rep. Edwards said is there often is a conversation when you're studying for this exam is to think as a generalist practitioner, which really means think as a white woman from the Midwest. And that's honestly how I've heard it presented in educational circles as well. Because the exam is supposed to cover all areas of practice, regardless of setting, place, location. And so how do you take out factors about culture, location, when you're actually working with people, right? You can't. Everyone's environment makes an impact on the services that you'll ultimately provide to them. And so for a lot of our folks, you're going against what you've been trained to do, to think in a generalist mindset instead of the client-focused mindset. And that's, I think, a really important distinction as we think about how people struggle with this, because you have to completely shift all of your years of education and practice experience and then really put yourself in just a whole new bubble. With my case with the person in Farmington Hills, you've been practicing in a school setting specifically for your entire social work career. And now you're going into an exam that you're going to have to learn, know diagnosis. You're going to have to know all of these other arenas and sectors of the profession that you will likely never end up in. And so, you know, the other thing that we haven't talked about yet, but we are completely supportive of specific practice-based exams. So if you want to be an addictions professional, if you want to get an additional certification that gives you expertise in the lane that you're in, we think that that's absolutely appropriate. And also where supervision is a really important piece of our advanced licensing, because those folks will give you experience, training, and guidance in the specific lane of social work that you end up practicing in.
Great, thank you. I really appreciate that more in-depth explanation. Thank you.
Thank you. Representative Thompson.
Thank you, Mr. Chair. So I too am trying to wrap my head around this because obviously I have not taken the social work exam. I absolutely agree with you. This makes sense to me as a clinical professional, as a nurse. Why are you waiting so long after your clinical education to take the exam? Because as a nurse, prior to me being licensed and able to work as a nurse, I took my NCLEX fresh out of my education. There were modules that I could study. So the NCLEX, and I never remembered, so I had to write this down, the National Council Licensure Exam for Nurses. So that too has those 4 questions. 2 of them are right, 2 of them are wrong. 1 of them is the right answer. And I know nursing is more specific. So within social work, can you give an example of one of those questions, if you can remember, that would be racially biased, so we can understand, or maybe let us know, let people that don't know, that haven't taken the exam, how the exam is presented, some of the questions, what are they asking you, because nobody's taken the exam, so it's hard for us to really get it in our mind. And I too want to thank you, because I know how important social work is to you, and coming to represent your district and fight for social workers is why a lot of us came here to do what we do in these committees. I came to fight for nursing. You came to fight for social work. So I respect that, and I thank you so much. But help us understand how those questions are racially biased so that we can understand.
I would say the questions aren't racially biased. The way we're supposed to take the exam has bias, because you're trying to eliminate all of your own personal identity from factors in how you take the exam. Like you mentioned with nursing, you're a very specific type of field. When you're taking a medical exam, you're likely doing like orthopedics or cardiac, whatever your particular lane is in that particular profession. With social work, you have to take your identity completely out of your scenario as you're taking the exam, and then the questions aren't going to be specific to your particular lane. I know that ASWB has a very diverse writing group of folks who look at the exam, that write the exam, and are continually trying to reinvest in that. But when I think about just the pass rates for the nursing exam in Michigan, it's about a 90% first-time pass rate here in the state of Michigan. For social work, it's an overall first-time pass rate of about 70% for social work, and about 30% for our black social workers, and about 40% for our social workers over 50. So not necessarily that the questions themselves may be biased, but the way you have to step in and frame how you answer questions creates a lot of confusion and ultimately has implicit bias included in it.
That, could you give an example of one of those questions, or is there a way for us to search what the test?
Representative Rheingans, quickly.
An example might be, I'm a white person. I grew up being taught my culture to do something, you need to be individually motivated. You need to be the one motivated for your own change. But in a lot of work I've been doing in the last few years, a lot of cultures are very motivated by family motivation. So a question might ask, how would you work with a client who needs to change a specific behavior? Would you adhere to their individual motivation? Would you talk to their mother? Would you work with their best friend? And then all of those are right. But a white person, white person from the Midwest, would answer to motivate them as an individual to change their behavior. But for some clients, that's the wrong answer, but for the exam, that's the best right answer. And that's not right. That's racist, in my opinion. It's also against multiple other cultures. So that's just an example.
Thank you.
Representative Hoadley, quickly, please.
Thank you, Mr. Chair, and thank you for your testimony. And Rep. Brabec, I know you've put a lot of work into this. You're very passionate, as everybody on the panel is, about mental health and getting better social work. Two things. One is you've used the comparison to other states and putting us in line with other states. How does Michigan match up in success with these other states? And by success, let me qualify that. And by meaning a difference between, are we looking at success being gauged on how many new social workers we're bringing into the field, or the quality of the care?
I mean, I think quality care is ultimately what everybody wants to care about at the end of the day.
So how are we stacking up to those other states that we're basing this legislation to fall in line with?
So one of the things that we know is that for example, in Illinois that I mentioned, when they looked at this, same kind of issues, because we're seeing this, and Dwayne talked about this, that a lot of other states are grappling with this as well. When they looked at reorganizing their licensure process, I believe the number I kept here was 3,000. Mm-hmm. They had an influx of 3,000 social workers. It wasn't that these folks were incompetent or unethical, or that was not the case. I want to be very clear about that. There are, again, I feel like I cannot overstate this. For me, being able to pass this test does not make you a good clinician. There are so many good clinicians who struggle with this exam. So this is not an issue of if you pass the current exam, then somehow you provide the best service. That's not what's happening. I've talked with so many social workers who work in our communities doing vital, important work each and every day, who struggle to pass the exam. And it is a loss to me, to our communities, to the profession, when they aren't able to continue to practice.
Great. So are they getting better end results?
I would add, I would say Michigan is not doing well, and nationally we're not doing well. When I think just of the most recent 3 years of data that's available, it was from 2018 to 2021, Michigan lost more than 300 social workers over the age of 50 and over 600 black social workers alone because of the inability to pass the examination. Are communities safer because there's just 1,000 less social workers that are able to assist at our schools? Are our community mental health who are struggling for workforce folks better off because there are less people that are even in the pool? We still want to maintain there's public protection, and that's where we have a board of social work, we have disciplinary review, and the more folks that are in our licensing process, the more folks who ultimately can be held publicly accountable if they do something wrong. When they're unlicensed, that creates a whole nother ball of wax when you have to either go through the legal process or there's no recourse for folks who then might be practicing in unethical or unlicensed manners.
Great.
I'm sorry, we have to move on, Representative. Thank you for your testimony. The House Policy Subcommittee on Behavioral Health will go at ease.
Thank you.
Okay, folks, we are back. We're just having to shift some things today because we are running out of time and health policy meets in this room at 10:30. So right now, we will continue to take more testimony on these bills, but we're going to switch to the bill that we talked about voting on today. So that is Bill 5178. Then we'll continue to do testimony on the other bills. But thank you for your flexibility because it's important to have these conversations. So today we're taking up 5178, which protects second and third party syringe service programs. We have an H1 substitute to that bill. It is in front of you.
That is not the bill. Sorry.
Is that the wrong number?
Chair. Oh, yes, sorry.
Okay.
I got confused with the other thing
Okay.
later today.
5178, yeah? Perfect. So Rep. Rheingans is going to tell us about the changes in the H1, and then we'll vote to adopt it, and then we'll vote on the bill itself. Rep. Rheingans.
Thank you. Thank you, Madam Chair. So as we heard testimony on this bill before, there were some questions about who is immune, where they're immune, for how long are they immune for being in possession of drug paraphernalia, specifically syringes. And we've worked with partners in public health, program operators, and law enforcement to really tighten up and clarify the language. We did make sure that it is, there's a definition in here that clarifies that a person who is working or volunteering in a program is only immune from these possession and distribution charges if they are in the act of being at work or in the act of volunteering. So after hours, not immune. It also talks about the drug paraphernalia of a syringe being exempt if it is empty or not used before, and that is to distribute the clean ones. We also talked about the amount of controlled substance somebody is allowed to be in possession of, and we changed it from an amount sufficient only for personal use, which is super variable, to trace or residual amount, which makes it clear that it is a very small amount inside the used syringe. We also removed immunity from use of a controlled substance because the prosecutors informed us that's barely ever used as a charge. Possession is usually the one that's used as a charge, so it doesn't need to be included in this. And with that, I will take questions and happy to talk more to folks too as we await a couple pending positions from some administration departments.
Thank you, Rep. Any questions on the sub for Rep. Rheingans? Okay. Seeing none, Representative Arbit moves, I can read the cards in afterwards, yeah? So Rep. Arbit moves to adopt the substitute H1 to House Bill 5178. Mr. Clerk, if you will.
On the motion to adopt, Chair Brabec.
Yes.
Representatives Arbit.
Yes.
Pohutsky.
Yes.
Edwards.
Yes.
McDonald.
Yes.
Rheingans.
Yes.
Hersberg. Schmaltz.
No.
Hoadley.
No.
St. Germain. Thompson.
No.
Madam Chair, you have 6 yeas, 3 nays, no pass. The substitute is adopted.
Thank you, Mr. Clerk. Before we vote, I'm going to be reading in the cards that we have. Daniel Chernin does not wish to speak and supports the bill from Michigan Association of Substance Addiction Providers. Linda Davis from FAN does not wish to speak and supports the bill. Steve Elsom from the Michigan Overdose Prevention Coalition does not wish to speak and supports the bill. Sarah Ishmael from Access does not wish to speak and supports the bill. Dr. Abdul Al-Sayed, the Director and Health Officer from Wayne County Health and Human and Veteran Services Department, does not wish to speak and supports the bill. And Matt Saxton from the Michigan Sheriff's Association does not wish to speak and opposes the bill. As written. Rep. Pohutsky moves to refer House Bill 5178 to the Health Policy Committee. Mr. Clerk, if you will.
On the motion to refer, Chair Brabec.
Yes.
Representatives Arbit.
Yes.
Pohutsky.
Yes.
Edwards.
Yes.
McDonald.
Yes.
Rheingans.
Yes.
Hersberg. Schmaltz.
No.
Hoadley.
No.
St. Germain. Thompson.
No.
Madam Chair, you have 6 yeas, 3 nays, no pass. House Bill 5178 is referred to the Committee on Health Policy as substitute H1.
Great. Thank you, Mr. Clerk. Thank you, colleagues. That was for you. Okay, so now I appreciate everyone being here, and I appreciate the interest in all of our bills. We're going to continue with testimony on 5184 and 5185. We're going to get as far as we can. I know we have another package of bills that we're hoping to get to. I don't know that we're going to have enough time today, and the questions have been great, but I just wanted to let folks know that. So first, oh, perfect. So first, we have Barb Hiltz, who is an LMSW. She's a clinical associate professor and Master of Social Work program director at the University of Michigan School of Social Work. Barb, come on up. And we will have 3 minutes. I appreciate that. Thank you so much.
I'll get started right away. I am honored to come to speak in support of the Licensure Modernization Act. My name is Barb Hiltz, and I'm the director of the MSW program at the University of Michigan School of Social Work. Our school provides a Master's of Social Work degree program accredited by the Council on Social Work Education and follows a rigorous program of study. For the reasons I'll describe today, the proposed changes will better enable qualified professionals to secure social work jobs that meet the needs of vulnerable residents of Michigan, as well as in other areas of the United States. So first, this legislation provides alignment with the licensing tiers of those in other states. The majority of our students at Michigan, around 60%, are Michigan residents, which means that about 40% are from other states where they may eventually seek licensure. By modernizing the licensure tier structure to the LBSW, LMSW, and LCSW, our licensure system will parallel that of other states and more seamlessly enable social workers to move into and out of Michigan, but also to perhaps hold licenses in multiple states in order to, for example, practice telehealth without confusion regarding the equivalence of licensing credentials. Second, this legislation removes Michigan's reliance on a licensing examination that has known disparities, and we heard testimony of that today, and I understand there's been previous testimony as well. Third, and connected, the pass rate disparities are present even under the most favorable of conditions. So at our prestigious university, at the University of Michigan, our overall pass rates are higher than the national average, yet still the pattern of disparities is present, despite the significant supports that we provide to all students. One could argue that students in our top-ranked program are best positioned to pass the exam. And the fact that the pattern of disparity is present even under this best-case scenario lends credence to the view that the ASWB exam is systematically flawed. And then fourth, simplifying a path to licensure and eliminating the testing requirement will facilitate growing the workforce at a time when that is desperately needed. Experts have projected a workforce shortage of upwards of 200,000 nationally, forecasting a crisis in the ability of professional social workers to serve children and families, elderly people, and people with mental health, substance abuse, and other health issues. In fact, right here in Michigan, more than 500,000 people have an unmet need for mental health treatment. Social workers represent the largest group of providers of behavioral health services in the nation, and therefore removing the barriers to licensure is a concrete step that you can take towards addressing unmet needs here in Michigan. In closing, I ask for you to support the Licensure Modernization Act and ensure that the residents of Michigan have access to professionals who provide counseling, support, advocacy, and systems change for the betterment of our state. Thank you.
Thank you so much. Colleagues, any questions? Thank you for your testimony. We appreciate it. Next, we have Dr. Kathy McComber. She is the Bachelor of Social Work Program Director and Assistant Dean of the College of Health and Human Services at Saginaw Valley State University. Good morning. Good morning. Thanks for being here. You'll have 3 minutes.
Yes. Social work programs, I'm honored to speak in support of the Social Work Licensure Modernization Act. My name is Kathy Maycumber. I am a social worker, duly licensed in the state
Doctor,
of Michigan.
is your mic on? Push that red button.
Sorry about that.
There you go.
Okay.
Thank you.
I'm Kathy Maycumber. I am a social worker, duly licensed in the state of Michigan in macro and clinical practice. And I serve as Assistant Dean in the College of Health and Human Services, as well as Director of the Bachelor of Social Work program at SVSU. SVSU provides both undergraduate and graduate programs in social work and graduates more than 130 professional social workers each year. The proposed legislation will allow these qualified individuals to serve the behavioral health needs of rural Michiganders in a timelier and more equitable manner. Rural areas of Michigan are the most underserved in behavioral health. Our most recent graduates obtained the majority of their jobs in rural and medically underserved areas of Michigan. These are also the areas where our current cohort of students are engaged in educational placements. The proposed legislation will allow these new professionals and future graduates to provide needed behavioral health services quickly, addressing the critical workforce shortage. I work closely with organizations like the Thumb Area Employer-Led Collaborative and the Michigan Center for Rural Health. The lack of behavioral health providers in our rural and medically underserved communities is at a serious level. The current licensure system in Michigan is an impediment to hiring and retaining otherwise qualified professional social workers who can meet the needs of rural communities. In schools, community mental health organizations, nursing homes, hospitals, and many, many other agencies and organizations, the need for licensed social workers is dire. While SVSU has a high passage rate for the current exam, we know that many of our graduates have been unsuccessful in passing the exam. This leaves them out of the workforce and unable to meet this desperate need. Social work is a profession of ethical and competency-based practice. The proposed legislation acknowledges this by removing an unethical and inequitable barrier to practice social work in our state. The legislation maintains the need for licensure and includes some of the most rigorous requirements for supervision and continuing education found in the United States. Social workers are advocates. We advocate for others to reduce and eliminate disparity, inequality, and injustice. In 2022, we learned just how unfair the ASWB licensure exam is. Advocating to eliminate the exam as a requirement when we know it is inequitable and unfair is the only thing social workers, given our commitment to social justice, can possibly do. That is why I'm here today speaking on behalf of myself, my profession, my alumni, and my current and future students. Thank you.
Thank you so much. Colleagues, any questions? Great. Thank you so much. We're grateful that you were here. Next, we have Jen Hirsch. She is a PhD candidate, currently an LMSW at Michigan State University. Welcome.
Hi. Thank you so much for the honor of testifying today. I am a clinical LMSW and only a PhD student. That probably only matters to academia, but I'm here in support of 5184 and 5185. I was a medical social worker for 6 years prior to transitioning to academia in mid-Michigan, and I recently contributed to a social and racial policy equity policy analysis on alternatives to the ASWB exam within social work licensure. I think we can all agree that licensure's purpose is protection of the public. When there are potentially incompetent people seeking licensure, such as when there's no training requirements or qualifications, then a competency exam is helpful in separating those who have experience and expertise from those that don't. But in our current setting, where we have high standards for social work education that is overseen by a competency-based accreditation process, a competency exam becomes a duplicative requirement. A core problem, I think, of the current ASWB exams is that they make this false connection between competency and safe and ethical practice, which has been discussed here. There's no evidence whatsoever that passing the ASWB exam leads to fewer complaints or better client outcomes. So the proposed bill helps Michigan to get social work licensure right and bring it in alignment with the purpose of licensing processes in the state. The social work exams focus primarily on cognitive aspects. That is what you can test in a multiple choice exam, but social work is very value-based practice. And so we use values to determine how we apply our knowledge. And to answer the question about why we take it after supervision, that's because ASWB requires that. But what if we are mostly testing knowledge, we are mostly testing book knowledge, not on the job practice experience that is highly contextualized with that particular client, that particular practitioner, that agency context. And it is really all of that relationship that determines whether or not we have therapeutic outcomes or not the specific intervention necessarily, but the relationship between that client and that practitioner. And that's not something we can test on an exam. It's also the regulatory architecture of our licensing process of the Board of Social Work that ultimately protects the public by removing unsafe and unethical practicing social workers by doing discipline or, if needed, by removing their license completely. The more logical exam within the licensure process would be the jurisprudence exam because it is directly connected to ethical safe practice. Rules like scope of practice, mandated reporting, continuing education requirements, those are overseen by our state laws, Michigan-specific laws. But there's nowhere in our current licensing process that ensures that licensed social workers within the state of Michigan are familiar with the laws that they will be held accountable to by our Board of Social Work. So a jurisprudence exam would ensure that social workers at the time of licensure are familiar with the state laws that they must practice within and is much more clearly, specifically connected to the goal of licensure, which is protection of the public. So to recap, I think we would benefit from focusing on the protection of the public. That would remove the ASW competency exam because that is a duplicative requirement and not directly linked to safe and ethical practice, where a jurisprudence exam would be much more connected and make sure that social workers in Michigan have a familiarity with Michigan state laws. So please support the Social Work Modernization Act. Thank you.
Thank you so much. Colleagues, any questions? Thank you so much for being here. The next two folks that we have are online, joining us via Zoom. First, we have Dr. Chandra Carr. She is the director of the Office of Practicum Education at Wayne State University School of Social Work. Dr. Carr.
Hi, thank you.
Good morning.
Good morning, Representative and members of Behavioral Health Subcommittee. My name is Dr. Chandra Carr. I live in Southfield. I am the Director of Practicum Education at Wayne State University. I support House Bills 5184 and 5185. I have been a social worker for over 20 years. Although I have a master's degree in social work and have worked in various areas of this field, the state of Michigan doesn't even recognize me as a social worker because I have not passed the ASWB exam. My professional road has been limited because of my exam. The experience, education, and reputation I have no longer matters. All that matters is if I have a license or not, which is based upon my ability to pass the exam. I often have been denied advancement in my career, denied opportunities, and was terminated from gainful employment because I did not pass the exam. I have been forced to take jobs that were beneath my qualifications, experience, and education in order to provide for my family. To this day, I continue to work multiple jobs in this field because the pay of one job is never conducive to allow me to provide the quality life I hope to provide for myself and my children. So I have to work even harder, which sometimes requires me to hold 3 or more jobs at a time because these are the only roles that are available to me that do not require a license. However, like many of my colleagues, we make time to study for this exam while neglecting our family and other obligations. We are also praying long and hard while striving to pass an exam that has been the only impediment to living the life we've earned and doing what we love. Each time we pick up the pieces after another setback, we have to pay over $250 for another exam opportunity when money for extras is already scarce. We make the sacrifice in hopes of passing and moving closer to a better salary, a better position, and a better future within a field we love, but we never seem to quite make it. I have personal friends who have taken this exam over 20 times and still have not passed it. We all, including myself, have come within 1 to 2 points of passing the exam and have to start all over again. We are not incompetent social workers because we have failed this exam, nor are we not well versed in the ways of social work in the communities we serve. However, the exam continues to insinuate that our years of service, education, and experience are all for naught. I love social work. I love helping people find their true selves and becoming better people. My experience and interaction with the field far outweighs anything an exam says I can or cannot do. The real world always has been a great teacher, and with my 20 years of experience, I have learned a lot, and I continue to learn more each day. I urge you to vote in favor of House Bills 5184 and 5185. I thank the committee for the opportunity to speak, and I'm happy to answer any questions you may have.
Thank you, Dr. Carr. Colleagues, any questions? There are no questions from the committee. Thank you, Dr. Carr, for being here this morning. Next, we have Trisha Duckworth, who has her MSW and is a community advocate. Ms. Duckworth, good morning. Thanks for being here.
Good morning. Hello, everyone. My name is Trisha Duckworth. I am a community advocate and please forgive me. It's going to take me a minute to get used to not calling myself a social worker. I was blessed to attain 3 degrees, working towards my goal of being a social worker. I've been limited licensed since March of 2015 and have been blessed to serve the community in many out-of-the-box ways. In an attempt to obtain full licensure, I took the necessary testing required by law. Unfortunately, after testing 3 times, I failed. After the first exam, I noticed the bias in the line of questioning and a severe lack of cultural competence. Yet, I still tried hard to pass and didn't meet the mark. This has left me in a terrible position as I have testing anxiety, which makes it nearly impossible for me to pass testing, even with accommodations. My limited license has expired, never to be renewed again. So after 6 years of school and $168,000 in student loans, I am no longer able to call myself a social worker when I do social work. This has been devastating for me and many others who have had to face this same roadblock. So as an ex-social worker, I come before you today to plead with you all to do away with any form of oppression that has been rendered through the administering of this test. Voting yes on these bills will help us continue to serve the community as we once were, social workers. Thank you.
Thank you, Ms. Duckworth. Colleagues, any questions? Thank you for that testimony. We really appreciate it. Next we have Brian, either Filson or Pilson. Hi, good morning, who wishes to speak and is opposed to the bill.
Good morning, Representative Brabec and committee members. My name is Brian Filson. I've been a licensed social worker in the state of Michigan for 39 years. I've worked in the field of child welfare, mental health, juvenile justice, both at the micro and the macro level. I was a governor appointee on 2 different governors to serve 8 years on the Michigan Board of Social Work. 7 of those years I served as the board chair. During that time, I had a firsthand seat to the licensing and regulatory process here in the state of Michigan. I've had the opportunity to volunteer nationally and had international conversations around social worker and the licensure and competency level conversations. I am here to voice my opposition to House Bill 5184 and 5185. While I believe that the modernization of social work legislated in Michigan is absolutely needed, I believe that the current legislation does not adequately address the needs of the citizens in Michigan or adequately serve the profession of social work moving forward. During my 39 years, I began when we were in registration, and then we moved to licensure, and so I have again seen Michigan move social work forward as a profession. My greatest concern is that this legislation will not only not move us forward, but actually will potentially deregulate us as a profession, and that really concerns me. Dwayne mentioned we have, he said 18 states in the Social Work Compact. I think that number is 20. If you pass this bill, I think future licensed social workers will lose the ability to practice and reciprocity and portability of licensure in all of those states who have passed the compact. And that number is going to continue to grow, and I think we have missed that conversation. The addition of a jurisprudence exam does not adequately address the needs of public protection, nor does it serve us in the assurance of social workers entering the field. Every Friday night, I watch vehicles go north to Michigan and exceed the posted speed limit sign. I think they all know what the law is. simply because we have social workers who know what the law is that going to assure safe practice? And I think previous testimony said it doesn't guarantee competency. And I think the same argument applies to jurisprudence. And I think we need to understand that. I fear the movement would be the same, and the conversation needs further explanation, and not enough time has been devoted to it. I understand that there's great motives and there's emotion behind this, but my greatest fear is that it's going to do that without the appropriate people at the table having the right conversations. And I've offered Dwayne. He says there's been a little work. Actually, there's been a lot of work, and so we need to move forward. Please don't leave Michigan behind. Don't fail Michigan social workers. Do not move forward until good education and conversations can take place. Thank you so very much for your time.
Thank you. We have one question, Representative Pohotsky.
I'll be very quick, Madam Chair. Thank you. You mentioned the compact states. Are we part of a social work compact currently?
We are not, and we are missing the opportunity to do that right now. If we truly want to modernize social work, then we need to be a part of that, and this bill to not have it.
But the second part of that question is you said that if we do this, we will not be able to be part of that compact, but we are not currently part of that compact. So
that's a great question. So if we remove...
No, I'm trying to keep it to the bill that we have before us. What was the point? Is your point that we should do that instead of this?
My point is that this legislation should consider that, because if we have licensees that are licensed without an exam, I don't believe they'll qualify to go to those states who have the compact, which has licensure.
But we're not part of currently anyway.
Correct.
Great, thank you.
Representative Edwards.
Thank you. You're currently on the ASWB board, right?
I am, yes.
Do you know how much money you guys make off this examination?
I don't offhand.
Okay. On the back of this sheet, it also provides information on the number of individuals, black people that pass this exam. It says 33%, whereas 63% of white people pass, right?
I believe so, yeah.
So have you guys taken any steps to modify the exam so that more black people can pass it?
Yeah, that's a great question. We have done a significant amount, and that's really the conversation I wish we'd have the opportunity to have. And NASW Michigan is not engaged ASWB in that.
Can you elaborate on what you have done to make the exam a little bit more?
There's a significant academic toolkits. As an example, University of Michigan leads the state in pass rates. We have institutions academically that have the lowest pass rates. So what is Michigan doing? And I think doing it really well, that other academic institutions. So there are toolkits for all academics, free testing materials, free opportunities, for individuals who have failed it to now be able to take free exam prep.
I'm sorry, have you done anything specifically to help minorities pass the examination? You provided pre-examination. I mean, you got to understand that black people are paying $260 per exam each time they do not pass it. So that's not once, it's multiple times. They are paying from $0 to $1,000 for training, tutoring, and examination courses or programs, right? There is the Therapist Development Center, there's Ages of Change, there's other programs. There's also books that we purchased to do this examination. What have you done? Don't give me a whole broad thing. Can you answer the question on what have you done to help more individuals of color pass this examination?
Yeah, there's significant things that have taken place. There's scholarships to help mitigate exam costs. There's all kinds of things. They're recognizing the dilemma and the issue.
Great. Thank you so much for that answer. We have Rep. Arbit, then Rep. Schmaltz, and then colleagues, we have two more people who need to speak, so we need to continue on here.
Thank you, Madam Chair. On this point, I'm just wondering, as a result of your efforts, have you seen a commensurate rise in black people and people of color passing the exam in recent years as a result of your efforts?
Yeah, so the latest exam data publication is getting ready. I, even as a board member, have not yet seen that, and so that's part of our research. Are the efforts and the levels of engagement, are we seeing positive effect? And so we're anxious.
We hope that you'll commit to sharing that data once it's released to this committee.
Absolutely.
Thank you.
Yep.
Thank you. We have one more question. And Rep. Schmaltz, I would just say we have two more people who we need to hear from today. Thank you so much.
This will be quick.
Thank you.
Thank you for being here. I know you're from my area, and I appreciate all the work that you've done to help people in our community. I think exam preparation from different institutions has a big effect on this and education, because data shows that black test takers from University of Michigan pass the exam at almost twice the rate of black test takers from Wayne State University. So I think we have a problem with the institutions and how they're teaching people to take this test.
Thank you for being here. We appreciate it. Colleagues, we're going to move on. We have two more people to testify. First, we have Dale Atkinson, who is on Zoom. Mr. Atkinson, are you there? He's from the Atkinson Law Firm. Hi, welcome. You have 3 minutes.
Thank you very much, and thank you, Representative Brabec and the committee members for hearing from me. And I want to thank everyone who has testified so far. These are discussions that need to be undertaken, and good questions are being asked. As mentioned, my name is Dale Atkinson. I'm an attorney. I represent ASWB as an outside counsel, general counsel to them. I also represent many other ASWB-like organizations. Most all of my clients develop, administer, score, and maintain uniform licensure exam programs used by their member boards as one criterion toward licensure eligibility. A quick reminder, the Michigan Board of Social Work is a member of ASWB. You all probably know that, and have input into all the programs that Brian just talked about, as well as leadership and policy making. The proposed bills I look at as substituting a jurisprudence exam in place of a entry-level competence exam. And so many statements have been made by those that have testified so far, and they're very conclusory statements. But the purpose of my remarks is to distinguish between a jurisprudence exam and an entry-level competence exam. A jurisprudence exam is what was already defined by someone, and that is it assesses one's knowledge of the laws of a jurisdiction. Those laws can include statutes and regulations. An entry-level competence exam is an entirely different instrument that is used to assess one's competence. And as has been discussed today and questioned, is that necessary, and is a bias or disparate outcome an indicator of an exam that cannot be defended? And the answer to that is no. The exam is legally defensible based upon the standards it uses to develop, administer, score, and maintain its program itself. And an entry-level competence exam is not a capstone to an education. It serves a very different purpose, and that's why almost all the professions have both an educational component and an exam component, because of the different roles that they play. Education is very subjective. Admissions, matriculation, graduation, and retention of students, and then ultimately graduation. Supervision is very subjective. Can a supervisor, one individual, say a person is not now competent to practice based on my observations as the supervisor, and do I get to make that decision? When you involve government in a licensure system, you need to be able to defend the decisions of granting or denying the license, and the examination is built on a platform that allows it to be defended. So very quickly, a licensure exam, and I support what Brian just talked about, and that is additional discussions about the development, administration, scoring, and maintenance of a uniform licensure exam program. But there's a survey instrument sent out to all
Mr. Atkinson, I just want to let you know your time just expired. If you could, 2 sentences to wrap up, please.
Thank you, and I apologize to take up additional time. Survey instrument, content identification, item writers, and then statistical analysis is extremely important to allow Michigan to defend its decisions as well. So I strongly urge this committee to have additional testimony about the exam program itself, since I ran out of my time as well. But thank you for having me. I would speak against this bill, these bills. And again, I appreciate everybody listening and everybody's questions.
Thank you so much. Colleagues, we're not going to be able to take questions. We have one more person that we need to get to. we have on Zoom with us Stacy Hardy Chandler from the Association of Schoolwork Boards. She obviously wishes to speak and is opposed to the bill. Good morning. You'll have 3 minutes.
Good morning. Thank you, Chairperson Brabec and distinguished committee members. I'm Dr. Stacy Hardy Chandler. I am a licensed clinical social worker, and I serve as the CEO of the Association of Social Work Boards. I am not a white woman. I think like myself. I directly credit factors that mitigated systemic factors that are operating against me in all aspects of society that operate against people like me, for the opportunity to serve the public as a social worker for over 35 years. I testified in front of this committee last November, and I am coming before you again in my capacity as a representative of the social work regulatory community to reassert our commitment to Michigan in upholding the will of practicing social workers, and let me emphasize, practicing social workers nationwide who support valid competence exams for their profession, for maintaining the professional status and consistency of social work licensure, and social work regulators' accountability for promoting the public trust and confidence. So it's not only my responsibility, but my personal and my professional honor to stand firmly behind the integrity of a social work-driven licensure exam process. And that's why I must testify in opposition to HB 5148. Remember, social workers are charged with serving the most vulnerable among us. We, as has mentioned earlier, as social workers are the largest group of mental health service providers. We serve those who often have little say in who their social worker will be or whether that social worker actually has the qualifications to serve them. So for more than 40 years, ASWB has taken that responsibility very seriously, knowing that the work of your board's members helps to ensure that those who enter the social work profession are qualified and effective in serving the most vulnerable people in our community. And we're talking about, of course, a wide variety of individuals, children, older adults, families. Along with our member boards across the U.S., ASWB has a responsibility to ensure that all social work licensure candidates possess the knowledge, skills, and abilities to competently and ethically practice upon entering the profession. Through my appearance here today in support of ASWB's exam program, I'm also defending the hundreds of social workers from across the profession who give their time, their experience, their expertise to ensure licensing exams accurately test for competencies required to enter the profession. The arguments I've heard labeling ASWB exams as invalid or racist are themselves invalid arguments. Like every other regulated profession, ASWB allows standards or follow standards that guard against bias in every step of exam development, from reaching out to representative demographics across the profession, directly reflecting the diversity of our profession in our exam writers and committees, subjecting each exam question to rigorous psychometrics, removing questions that perform differentially across demographics, and ensuring that the exam is at a 10th grade reading level. There was a question about choosing
Dr.
among
Hardy
options.
Chandler.
If you practice social work, you have to, pardon me?
Dr. Hardy Chandler, your time is up. Can you literally 2 minutes, because we have a committee coming in right now.
Sure.
Thank you.
I encourage having regulators at the table when we're talking about options, and ASWB is operating to evolve its test. But let me just say this, if we do everything right, we still require our partners across the system to move the needle. We can't fix racism, we can't fix anti-Blackism, but we can do our part, and we are.
Thank you
I
so much.
invite the opportunity to share more about that.
Thank you so much. Folks, we have 4 cards here. We have Dan Sheeran, who does not wish to speak in support of both bills. We have Alan Bolter, who does not wish to speak in support of both bills. I'm sorry. Dan Sheeran is from the My Care Council and My Behavioral Health and Wellness Collaborative. Alan Bolter does not wish to speak in support of the bills from the CMHA Association of Michigan. Not wishing to speak in support of the bills, Elizabeth Cutter from Michigan Health and Hospital Association. And not wishing to speak opposing the bills is Gabe Basso from Blue Cross Blue Shield of Michigan. Representative Holdley moves to excuse absent members. Committee, thanks so much. I appreciate it. We will continue next week with CCBHCs, but thanks for all of your great questions. If you have any other questions that did not get answered, Rep. Holdley, I know you had a question. Please get them to me and we'll get them answered. With that, committee is adjourned. Thanks, everybody.